Welcome to a new episode of our weekly web series, Science in Context. Following the development of vaccine technologies for COVID-19, Science published a study on how the current policy environment can best support the public health impact of other vaccines. I'm Sabine, and joining me today is Professor Nimalan Arinaminpathy. Nim, your paper concentrates on influenza specifically. Can you tell a bit more about why we need a new influenza vaccine in the future?
So when we look at current influenza vaccines, they have lots of limitations. They have to be updated every year or reasonably regularly at least in order to keep up to date with viral evolution. And also they can't be used in order to protect against a future pandemic of influenza. So there's been a lot of interest in developing new influenza vaccines, broadly protective or sometimes called universal flu vaccines, that don't have to be updated quite so much, but also could be useful for future pandemic protection.
Your paper highlights how we can think about economic aspects of future vaccines as well as their scientific development. Can you explain a bit more?
Obviously, there's the ongoing work in the scientific development of these vaccines, but what we're arguing is that it would be really important to anticipate the commercial environment in which these vaccines would emerge. So one of the things that we argue is that as a public health community, we can try and fashion that environment in order to maximize the public health benefit of these vaccines. For example, if we had a global market for future flu vaccines, where you have regional production capacity in different parts of the world, and that's able to meet regional demand for these vaccines, then this would make a lot of commercial sense, and it would also make a lot of public health sense. And so we list some of the ways in which these benefits could be realized on both the commercial side and the public health side.
How do these considerations relate to future vaccines for other infectious diseases?
We did consider comparisons with human coronaviruses and tuberculosis and two other major respiratory infections. Tuberculosis is quite different. It's a leading cause of death due to infectious disease. It's got a very strong public health case for these vaccines, but unfortunately the commercial case for developing future TB vaccines is not as great as for flu because it's a disease of poverty. If we have interventions from international donors and so on, these are needed to an even greater extent than for the influenza vaccines.